I call the member for Chisholm.
Deputy Speaker, the Morrison Government has been at the helm of Australia's leadership while going through the most significant health crisis we've seen in modern history. Many countries have taken big hits throughout this crisis. They've suffered major casualties and seen the healthcare system fail. It is with pride that I can say that with the Morrison Government steering the ship that is Australia, we have avoided the treacherous waters that many other countries have strayed into. While we have managed the COVID-19 health crisis with aplomb, health was always a priority for this government prior to the pandemic. Mr. Deputy Speaker, the Morrison Government has always recognised the importance of ensuring Australians have access to mental health resources and support. Our government is leading the way on mental health reform by investing a record $2.3 billion in the National Mental Health and Suicide Prevention Plan. Based on the principles of prevention, compassion and care, the plan will invest $1.3 billion in high-quality and person-centred treatment, including $820.1 million for a national network of mental health centres for adults, youth and children through the Head to Health and Headspace programs. For a long time, Australians were so focused on their physical health, and we didn't recognise the effect of our mental health can have on our quality of life. Under the Morrison Government, this has changed for the better. We care for the mental health of Australians, and we are making significant and meaningful reform to improve the mental health of all Australians. Now, Mr. Deputy Speaker, our healthcare system is envied across the world. We have an efficient and cost-effective public health system that works for Australians, catering for all. This isn't just reducing the cost of seeing a doctor or getting necessary surgery. This also includes the Pharmaceutical Benefits Scheme, a scheme that sees the government heavily subsidise life-saving medication for those in need. Astoundingly, since 2013, the Australian government has approved more than 2,677 new or amended medicine listing on the PBS at an overall investment by the government of $13.2 billion. This represents an average of around 30 listings or amendments per month, that is, one a day. I say this is an investment because it's exactly what it is. Unlike the Labor Party, the Morrison Government sees these new listings as an investment in Australians. The Australian people deserve it, and the Morrison Government will, like it always has, deliver on its promises to the public. By comparison, Labor stopped listing medicines in 2011. In the 2011-12 portfolio budget statements, it explained that the listings of some medicines would be deferred until fiscal circumstances permit. On the 25th of February 2011, Labor announced the unprecedented deferral of the listing of a number of medicines under the PBS, including medication for the treatment of schizophrenia and the treatment of endometriosis. This tells me that they care little for the mentally ill and the women of this country. Labor could not manage the economy and chose to compromise on the health.
Pause for a moment. The member for McCarthy.
I totally object to that description.
What's your point of order, the member for McCarthy?
On the truth, the relevance.
No, that's not a point of order. That is not a point of order. No, the member is being relevant to the topic. Oh, the chair doesn't, as you well know, the chair doesn't adjudicate the truth of these things. The member for Chisholm.
Labour could not manage the economy and chose to compromise on the health of the most exposed and most vulnerable. This was a callous and horrific
has
act by
expired.
the